welcome. You're watching NDTV 24/7. I'm Sonal Mehrotra Kapoor. This is a special broadcast where we discuss everything to do with diabetes and also with heart diseases. Now, COVID-19 pandemic has had its positive and negative impacts on various lifestyles, and everybody has responded differently to it. But negative lifestyle behaviors associated with COVID-19 has been the increased risk of adverse outcomes. For example, while dealing with COVID, we overlooked the fact that people's lifestyles were severely disrupted. Many people became physically inactive, developed irregular eating patterns as well, which leads to unhealthier lifestyles and then in return aggravated several disorders. This could be diabetes, it could be heart diseases as well. But these significant changes in our homes, in our work life, in our stress levels as well, requires now a multi-sectoral approach in trying to treat with these disorders. Many have called these times a diabetic epidemic, as many who had pre-diabetes, it surfaced, many who had diabetes running in the family, suddenly at younger age, they are discovering all these diseases. So be it diabetes, Facts and Myths is where we take all your questions related to lifestyle, related to medicine and the disease itself to a panel of doctors. Joining us today, we've got Dr. Sandeep Sahu, MD, DM. He's an associate professor as well at the High Tech Medical College in Bhubaneswar. Thank you so much for your time. Dr. Sahu, also with us is Dr. Madhav Prabhu. He is MBBS, MD, General Medicine Consultant Physician at KLE Medical College in Belgaum. Welcome to the show, Dr. Prabhu. And we also have with us Dr. Hariballav Mahapatra. He's MBBS, MHSC, PGD, Clinical Endocrinology, and amongst various other things, he is a diabetologist at Shri Hospitals in Bhubaneswar. Welcome to the show. Looking forward to this conversation. Let's take the first question to Dr. Sandeep Sahu. Dr. Sahu, is it true that people with type 1 diabetes are more prone to infections? Also, what is the association really between COVID-19 infection and the new onset of type 2 diabetes?
Yes, in type 1 diabetes mellitus patients who are found to be slightly older, they are more prone for the COVID-19 infection as compared to the young onset of type 1 diabetes mellitus patients. But the overall rate of hospitalization and severity of illness are found to be similar in both type 1 and type 2 diabetes mellitus patients. Also in type 1 diabetes patients who are found to be poor glycemic control, higher HbA1c level, underlying microvascular complications, they are more prone for severe infection as compared to the type 1 diabetes patients who are found to have no complications. And as far as the new onset of diabetes is concerned in the COVID-19 infection, it has been found that the SARS-CoV-2 virus, which causes COVID-19, the AC enzymes can attach to the receptors in kidney, adipose tissue, pancreatic beta cell and small intestine, and thereby causing the alteration in the glucose metabolism and thereby causing new onset of diabetes mellitus.
Dr. Madhav Prabhu, let me come to you next. Now, mucormycosis is a rare but devastating condition, right? That is more likely in people who have uncontrolled diabetes. Are these and in fact, like this, are there any other fungal infections, do you think, that people with diabetes should be susceptible about?
See, Sonal, let me tell you what the background for this is. Diabetes is an immunocompromised state, which means that if a person has diabetes, his immunity is lower. The factors that happen, you see, at your studio or in my clinic, everywhere there are fungus. There are spores present in the atmosphere. So what happens is, whenever your immunity goes down, you will have opportunistic infections. So normally these organisms never cause infections. But when your immunity is down and diabetes is an immunocompromised state, that is the time when all these fungi start invading your body. So when we had this COVID pandemic, there was mucormycosis. Added to the fact that COVID itself causes immunosuppression, diabetes caused immunosuppression, and then we had mucormycosis. So mucormycosis caused sinusitis, you had infection of the brain, the eyes, and we had to operate all these cases. 70 or 80 cases we have done here in my hospital. But then there are also other fungi or parasites that can infect a patient. For example, we have a fungus known as Candidiasis. This Candidiasis in diabetes can become invasive. It can go and reside in the esophagus, cause esophagitis. Then you have difficulty in swallowing. It can go and invade into the organs and cause invasive Candidiasis, which is a very serious disease. This is what we call white fungus. Then we have Aspergillus. Aspergillus causes pulmonary infections, especially when you are after COVID. If you have some cavities, there also we are getting a lot of cases where we are getting aspergillosis. There is, as you said, mucormycosis. And one more deadly infection is cryptococci. Cryptococci can invade the meninges. It can cause cryptococcal meningitis. It can also invade the brain and cause infection in the brain. So overall, especially what happens is nowadays we are getting diabetics in the elderly. And these diabetics, the elderly again is an immunocompromised state. Along with diabetes, when we have this, we are getting more and more infections, especially with all these fungi that I just mentioned.
Dr. Mahapatra, is there any association between type 2 diabetes and sort of post-operative pneumonia? And how does diabetes really affect morbidity and morbidity specifically in COVID-19?
There is a strong link between both of them. Patients with diabetes, they are immunocompromised, and there is a decreased clearance of the pathogenic organisms, that is the organisms that cause various types of diseases. There is a decreased clearance of those type of organisms from the system because of the defective immunity. And patients who are admitted to the hospital and post-operatively they are getting infection of the lungs, that is pneumonia, then that is called post-operative pneumonia. Majority of the patients, they get this infection because of the aspiration of the gastric contents into the lungs. And patients with diabetes, because of their immunocompromised state, they are at a very high risk of developing any sort of infection. It's not only about post-operative pneumonia, any type of infection you take, whether it's infection of the lungs or soft tissues of the body or foot infections. They are very commonly seen in patients with type 2 diabetes. And coming to the second part of your questions about the morbidity and mortality of COVID-19 in patients with type 2 diabetes or diabetes as a whole, patients with diabetes again are at high risk of contracting the disease. The disease severity is also high, and patients with diabetes, they require a long hospital stay for COVID-19 treatment. It's not only about the present hospital visit, subsequently also there is a high risk of developing post-COVID complications.
Next question, a very basic one, but something that all of us need to understand perhaps. Dr. Sandeep Sahu, if you could tell us that type 1, type 2 diabetes are two different types with different mechanisms altogether. If you could tell us what exactly and how exactly they're different. Even the age of onset is different, right? And in any symptoms that one must in a way watch out for when it comes to type 1 and type 2 diabetes, and how exactly similar or different are they?
As far as the symptoms are concerned, the osmotic symptoms, that is the polyuria, polydipsia and polyphagia, are found to be similar in both type 1 and type 2 diabetes mellitus patients. Along with the osmotic symptoms, the type 1 diabetes patients can present with DKA and upper respiratory tract infection and fever at the onset sometimes. So, also in case of the type 2 diabetes mellitus patients, along with the osmotic symptoms, they can also present with low vision, numbness and tingling of the extremities, poorer wound healing, and sometimes recurrent fungal infections, etc. So the symptoms are usually similar, but in type 1 and type 2 diabetes mellitus, the presentation may sometimes vary.
Dr. Madhav Prabhu, let me come to you next. The measurement of vital signs is an important part of a clinical workup, right? Now, looking at increasing prevalence of this new onset of diabetes, should blood glucose be tested in all patients who are hospitalized, and should it be considered as the fifth vital sign then perhaps?
So let me give you a background for this. The background for this question, and this debate is ranging for a long time now, is that a patient who is, we usually don't measure serum glucose levels in patients who are non-diabetic. You see, when a patient comes to you with heart attack or stroke or something like that, there's something known as stress-induced hyperglycemia, which means that the sugars in a non-diabetic patient are also high. And we have seen that those patients who come with the higher sugars have a very poor prognosis. They have more morbidity, they have more mortality. Patients even who had little bit of glycemic variability. So what is glycemic variability? Sometimes the sugar levels are below the threshold, sometimes they are above the threshold. So there is a huge difference in the sugar values. So whenever this glycemic variability is there in patients, we have seen that there has been a lot of morbidity and mortality with patients. That means they are very sick and they have serious disorders. So this is one part of the spectrum. The other part of the spectrum is hypoglycemia. So here, if we are talking about high sugars, on the other side, there are hypoglycemia where there is low sugars. And here patient can be comatose, he can aspirate, there could be added brain injury. There are so many complications with hypoglycemia. So the entire spectrum of hyper and hypoglycemia can be detrimental to a patient coming to us. So that's why this debate has come forward whether we should routinely check the sugars of a patient who comes to us irrespective of his diabetes status. See, I always tell my students that doing pulse, BP, sugars and the pulse, BP, respiratory rate and temperature, the 4 normal vitals, these will only give us a picture. That is a static picture. Whereas sugars give us a running picture as to what is happening at the metabolic level. And that's why I believe we should, and this should become a standard recommendation now, that you should have sugar levels as a normal sign or a normal vital
sign, as
measure,
fifth
vital sign when we routinely examine our patient. But because that is going to definitely have a big role in the prognosis of the patient.
This is a good information to have. On that note, let's take a break. When we come back, our question and answer series with the doctors continue. Welcome back. You're watching Beat Diabetes, Facts and Myths. We are in conversation with our panel of experts. Let me take the next question to Dr. Mahapatra. Dr. Mahapatra, type 2 diabetes, which is commonly known as adult onset diabetes, now seems to emerge in all age groups, not adult anymore, including younger population as well. What are the common causes for type 2 diabetes to appear and surface in younger people?
Yes, as you have rightly mentioned, type 2 diabetes is no more a disease of adults nowadays. We are getting patients with type 2 diabetes who are pretty young. Even children and adolescents are also getting type 2 diabetes. This is because of the unhealthy lifestyle that we are adopting. Insulin resistance stands as the major concern behind all these pathologic mechanisms. Because of our unhealthy lifestyle patterns like unhealthy eating, disordered sleeping pattern and stressful life. More importantly, lack of physical activity is the major reasons behind this rise in the patients with type 2 diabetes who are young. And if you see genetically, we are also more prone to get diabetes because of our Indian origin. And those with the family history of diabetes, they are also at high risk of developing type 2 diabetes at a very young age.
Right. Dr. Sahu, let me come to you next. Can early short-term insulin treatment in people who have recently been detected with diabetes help to reverse type 2 diabetes?
Thank you for the question. And there are certain indications where we can start insulin in type 2 diabetes mellitus patients. That is HbA1c level of more than 9 to 9.5%, fasting plasma glucose level of more than 250 mg per deciliter, and hyperosmolar coma, associated infections, etc. In patients with HbA1c level of less than 9%, also we can start insulin. And by starting insulin at an earlier stage, we can improve the insulin sensitivity. Also, we can increase the beta cell function and mass. All these things happen because of decrease in the glucotoxicity of hyperglycemia by giving the insulin therapy. So, we can start insulin at an earlier stage in patients with type 2 diabetes mellitus.
Dr. Prabhu, the next question is for you. Should the diabetes medication doses need to be revised as people with diabetes are working from home and tend to have a major shift in their lifestyle, including their body weight?
Yeah, absolutely. You see, working from home has disturbed a lot of schedules of our patients. You know, there are long working hours. People initially said that working from home would be less stressful, but nowadays you know that there is more working hours that are involved. There is physical inactivity. There is psychologically the patient is insecure because jobs are not very easygoing nowadays, and this results in tension hogging. There's a lot of other factors which are contributing to this, and thus the sugars and the weight both are going up. So this has become a really problematic situation for us doctors. But you should understand that only increasing the dose or changing the medication is not the answer to it. You have to modify your lifestyle according to your, staying at home. So what I advise my patients routinely is that you should make your schedule, or you should map your schedule. What you are doing is you are understanding the rhythm of your life now. What time you're going for meetings, what time you're having your food, what time you're having your medications. So this will give you an idea as to what time you can do your tests and at what time you can take your medications. That is very important to keep that time for it. You have to take, you have to treat diabetes as an important appointment, and an appointment which is not cancelable. So this you can do with setting up alarms as to when you have to take your medicines or food. You can schedule your meetings accordingly. There's also, you have to move around. You have to be active. I can suggest that if you have 5 minutes for a break, you go outside, you walk a flight of stairs, and then you can come. You can do that. Some people use weights and Pilates bands. They can be kept under your working station, and whenever you get time, you can just use that weights and Pilates bands, and you can tone your muscles. That also helps in decreasing the insulin resistance. See, if you do all these things, you're going to do your exercise in time, you're going to have your meal in time, you're going to do some physical activity. You are not going to have high sugars. If you're doing all this and yet your sugars are jumping, then it's time to meet your doctor. Tell him, sir, aisa problem ho gaya, and that is the time he will change your medicines. Perhaps increase a dose a little because of the increased sugars that are there. Basically, the idea is to keep your sugar within normal range, and that you should ask your doctor once you have taken all these steps regarding controlling sugars.
Right, those are some good tips over there. Thanks for that, Doc. Let me take the next question to Dr. Mahapatra. Dr. Mahapatra, what are the new advancements in terms of insulin injections? Now, we have heard about newer insulin pumps that have more effective than normal insulin injections. Could you tell us a little more about this, please?
Yes. This year we are celebrating the 100th year of insulin discovery, and since its discovery in 1921, insulin has saved the lives of millions of people with diabetes. Someone with type 1 diabetes will be requiring insulin for his survival, whereas patients with type 2 diabetes will be requiring insulin for his control of blood glucose and prevention of diabetic complications. Despite its enormous benefits, insulin is not very much accepted among the patients because it's an injectable preparation and the patient has to inject every day to get benefit out of insulin therapy. If you talk about the newer insulin preparations in the Indian market, we are having two different types of insulins at the recent times. One is insulin regulatic and the other one is insulin FIASP. FIASP stands for fast acting aspart. It is very much rapidly acting insulin and it is very much effective in controlling the postprandial blood glucose, that is the post-meal blood sugars can be controlled effectively with FIASP. Whereas insulin regulatic is a long-acting insulin and it can be given in a once daily shot. It is very much effective in controlling the fasting blood glucose. At the same time, once in a week insulin, icodec is in the pipeline that is being investigated, and if successful, icodec can be given as a once in a week preparation. Coming to the next question about insulin pump. Insulin pump is a pager-sized device. It's a very small device that can be attached to our abdominal wall and it can deliver insulin throughout the day over a period of time. And we need to change the tubing of the insulin pump every 2 to 3 days depending on the patient's usage. And the device is a bit costly, but definitely it can improve the blood glucose control and the HbA1c, that is 3 months average glucose control can be improved by the usage of insulin pump. It's very much accepted among the patients. And the patients need to be educated about the insulin pump prior to the usage of the device.
All right, I guess that's all the time we have on the program. Thank you so much for watching. Bye-bye for now.